Introduction. Welcome, medical students, to today's lecture on endocrinology. In this comprehensive script, we will delve into the intricacies of the endocrine system, focusing on the various hormonal regulatory mechanisms that maintain homeostasis within the human body. From the hypothalamic pituitary axis to the neural control of endocrine regulation, we will explore 12 key topics that will provide you with a profound understanding of endocrinology. So, let us begin our journey into the fascinating world of hormones and their critical role in maintaining our health and well-being. The hypothalamic pituitary axis is a complex system that governs the release of hormones within the body. The hypothalamus, a region located in the brain, secretes various releasing hormones that act upon the anterior pituitary gland. These releasing hormones stimulate the pituitary gland to produce and release specific hormones that target various endocrine glands throughout the body. For instance, the hypothalamus releases thyrotropin-releasing hormone, TRH, which stimulates the release of thyroid-stimulating hormone, TSH, from the pituitary gland. TSH, in turn, acts on the thyroid gland to regulate the production and release of thyroid hormones, essential for metabolism and energy regulation. Calcium homeostasis, crucial for maintaining proper bone density and muscle function, is regulated by several hormones. When the calcium levels in the blood drop, the parathyroid glands, located in the neck region, produce parathyroid hormone, PTH, which acts on the bones, kidneys, and intestines to increase calcium absorption, release calcium from bones, and reduce calcium excretion in the urine. Conversely, when calcium levels rise, the thyroid gland releases calcitonin, which promotes calcium deposition in bones and inhibits calcium reabsorption in the kidneys. The hypothalamic pituitary adrenal, HPA, axis plays a vital role in the body's stress response. During stressful situations, the hypothalamus releases corticotropin-releasing hormone, CRH, triggering the secretion of adrenocorticotropic hormone, ACTH, from the pituitary gland. ACT stimulates the adrenal glands, situated on top of the kidneys, to produce cortisol, a hormone that aids the body in responding to stress by increasing blood glucose levels and suppressing the immune response. Dysregulation of the HPA axis can lead to conditions such as adrenal insufficiency or Cushing's syndrome, with consequences ranging from fatigue and weight loss to hypertension and immune system impairment. The regulation of blood glucose levels is a dynamic process involving the interplay of insulin and glucagon, two hormones produced by the pancreas. When blood glucose levels increase, beta cells in the pancreas secrete insulin, which promotes glucose uptake by cells, storage of excess glucose as glycogen, and the inhibition of glucagon release. Conversely, when blood glucose levels drop, alpha cells in the pancreas release glucagon, stimulating glycogen breakdown and glucose release into the bloodstream. Disruption in the delicate balance between insulin and glucagon can result in conditions like diabetes, where impaired insulin action leads to hyperglycemia. The thyroid gland, situated in the neck, synthesizes and secretes thyroid hormones, triiodothyronine, T3, and thyroxine, T4 that play a vital role in regulating metabolism, growth, and development. The hypothalamus releases TRH, stimulating the pituitary gland to release TSH. TSH, in turn, acts on the thyroid gland, promoting the synthesis and release of T3 and T4. These thyroid hormones, working through negative feedback mechanisms, exert control over the hypothalamus and pituitary gland to maintain thyroid hormone levels within a narrow range. The adrenal glands consist of two distinct regions, the adrenal cortex and the adrenal medulla, with each producing different hormones. The adrenal cortex synthesizes glucocorticoids, for example, cortisol, mineralocorticoids, for example, aldosterone, and small amounts of sex hormones, for example, estrogen and testosterone. These hormones regulate various body functions, including stress response, electrolyte balance, and reproductive processes. On the other hand, the adrenal medulla releases adrenaline and noradrenaline, which rapidly prepare the body for the fight or flight response during stressful situations. The gonads, testes in males and ovaries in females, are responsible for the production of sex hormones, including testosterone, estrogen, and progesterone. In males, luteinizing hormone, LH, and follicle-stimulating hormone, FSH, released by the pituitary gland stimulate the Leydig cells in the testes to produce testosterone, necessary for the development of secondary sexual characteristics and normal reproductive function. In females, LH and FSH promote the maturation of ovarian follicles, leading to the release of estrogen and progesterone, essential for the menstrual cycle and maintenance of pregnancy. Growth hormone, GH, produced and released by the anterior pituitary gland, plays a crucial role in regulating growth and development from childhood through adulthood. GH acts on various tissues to stimulate their growth and differentiation. growth hormone deficiency or excess can have significant impacts on an individual's growth, leading to conditions such as dwarfism or gigantism. Additionally, GH plays a vital role in metabolism regulation, thereby influencing body composition and energy utilization. Reproductive processes are tightly regulated by intricate feedback loops involving the hypothalamus, pituitary gland, and gonads. For instance, in females, the hypothalamus releases gonadotropin-releasing hormone, GnRH, which prompts the pituitary gland to secrete LH and FSH. These hormones, in turn, stimulate follicle development and estrogen production in the ovaries. Estrogen, alongside other signals, exerts negative feedback on the hypothalamus and pituitary gland. Similar feedback mechanisms occur in males, ensuring the regulation of testosterone production and sperm development. Endocrine disruptors are substances that interfere with the hormonal regulation within the body, leading to adverse effects on health and development. These disruptors can be found in various environmental sources, including certain chemicals, plastics, pesticides, and even some medications. Exposure to endocrine disruptors has been associated with reproductive disorders, developmental abnormalities, metabolic disorders, and an increased risk of certain cancers. Circadian rhythms, biological processes that follow a 24-hour cycle, play a crucial role in hormonal regulation. The suprachiasmatic nucleus in the hypothalamus acts as the body's central pacemaker, synchronizing various physiological processes, including hormone secretion, with the external day-night cycle. Hormones such as melatonin, cortisol, and growth hormone exhibit distinct circadian patterns, influencing functions like sleep-wake cycles, metabolism, and immune response. Several regions of the brain, including the hypothalamus and brainstem, exert neural control over the endocrine system. Neural signals from these regions can directly influence hormone release from endocrine glands. For example, sympathetic nerve stimulation to the adrenal medulla triggers the release of adrenaline and noradrenaline, enabling an immediate stress response. Additionally, the brain can modulate hormonal regulation through complex feedback pathways, integrating various signals to maintain homeostasis. In conclusion, the endocrine system encompasses a vast array of hormones, glands, and intricate regulatory mechanisms that ensure the proper functioning of our bodies. From the hypothalamic pituitary axis to the neural control of endocrine regulation, each topic explored in this script has provided us with valuable insights into the complexity of endocrinology. Understanding these hormonal pathways and feedback loops is crucial for healthcare professionals to diagnose, treat, and manage endocrine disorders effectively. As you continue your education, I urge you to delve deeper into this captivating field, further enriching your knowledge and contributing to the advancement of endocrine research and patient care.